Hello everyone, I'm Dr. Usman from Islamabad, Pakistan. I would like to thank International Forum for Promoting Homeopathy uh, for giving me the opportunity to express on today's topic. I would like to thank the President of International Forum for Promoting Homeopathy, Dr. Ismail Said, and Secretary Babu Rajan, and Treasurer Anil Kumar. And I would like to thank also Vice President Dr. Shaji Vargasi Kudiar for giving me the opportunity. And also I would like to thank one of my mentors, Dr. Javed Akhtar from Pakistan. Now coming to the topic, today's topic is management of patient using homeopathy. So the topic is quite general, but there are a lot of things which we can see how we can manage a patient. Management is a bigger, broader term. And I would like to explain how homeopathy can help, how homeopathy can manage patients in a minimum time with a minimum dose. These are all what I have said, minimum time and minimum dose, these are all separate topics. And they can take one separate session instead. But today we'll discuss only management of patients using homeopathy. So how we can manage a patient? As from the emergence of homeopathy and our organon first aphorism, we have to treat a sick. How we can treat a sick? It's the prime objective of the physician to treat the sick one. Who is the sick one? Sick one is the we can say the person or a patient with sick one is in a diseased condition when that person comes to the homeopathic doctor or a clinic. So what we have to understand is what is that disease condition of that patient. The disease condition of that patient is the word. First, we have to elaborate disease. What is disease? Disease is if we disintegrate this word disease at this is that means the person who is visiting a homeopathic doctor is at this ease. Is not in his easy mode. That so what homeopathic and homeopathic doctor has to do to that patient is he has to make that discomfort, this ease condition to a normal cured condition. So this is the first step of
Dr. Usman, could you talk much louder? Your voice is so feeble.
Okay. One of our participants said that I should talk a little bit louder.
Okay.
Hear me right now?
Okay. Good.
Okay. So that dis-ease condition is our aphorism number one. So what we have to do, the main process from which homeopathic doctor can deliver cure to his patient is from the case taking. And from where the case taking starts? The case taking starts from the very first contact of the patient and patient with the doctor. And what that very first contact would be. This would be direct interaction. And in today's society, in today's fast gadget-free society, patient can contact doctor with by telephone call, by either any medium using, and patient can be far away from the doctor. So these are all the stages what doctor has been interacting day to day with their patients. So how we can manage the patients with when they are far away from us, and those patients which are personally visiting the clinic. The methodology between all that is case taking. The important aspect that how we can deliver, how we can manage that patient through homeopathy is the most important thing is how we can take the case of that patient. In that case taking, it is the core ingredient from where you can start observing the patient. How we can observe the patient and how we can pick the symptoms what patient himself saying by his or her mouth. We have to calculate, we have to see uh, how much weightage we have to give to all such things. So in homeopathy has three major systems of cure, which can be classical homeopathy, which can be sensation method, which can be Sagal's mind method. So I would like to focus mainly on Sagal's mind method. That is my expertise, and I'm practicing also in the Sagal's mind method. So, in the mind method, when we are managing the patient, now patient contacts and comes uh, to the clinic. Assume there is a patient and it comes to the clinic of the and with the pain, with the severity of the pain. When the patient comes to the doctor with the severity of the pain, what would doctor focus on? The main aspects is how the patient is coming, whether limping or walking normal, and what kind of pain, where is that pain, and associated gestures of the face, body, expressions. These are all the main aspects of the which one the doctor has to focus on. And this is how homeopathy can manage. It looks very difficult. Like in, when doctor sees all that, it's a routine matter. It's a routine matter. For example, if a patient, we were talking about, the patient comes to the clinic with a pain. Now, the first impression is the gestures. This is making uh, different faces like, ah, oh, I've been performing it like that. These are all the gestures. We have to focus on all that. Whether how the patient contacts us, he comes, makes gestures. From here, we are picking up the case and the rubrics. Then comes if patient says he's restless, he or she is restless, and whatever. So the in this explanation, what I have explained about the gesture is we have a very beautiful rubric, the repertory. Gestures make extravagant. If the patient is coming and is making different faces, that is gestures making extravagant. Is It contains four remedies. So when doctor sees, we can bring the case by narrowing it down with that rubric because it contains four remedies. And when we take restlessness and some other rubrics, for example, if the restlessness is on height and one more thing is, then belladonna may be the remedy. So I'm not concluding it towards the remedy, but I'm talking about how we can uh, reach the right minimum and how we can manage it by administering the dose immediately to the patient. And this is how we solve the case in a minimum time with the minimum of data we have collected from the patient. This is one example of what I have been talking about the management of the patient. Now comes further towards the step that case taking in how many steps there are further in the case taking. There are a lot of steps, but I'll try to conclude some of that. Uh, Case taking comprises of, if we count it as 100%, then 93% of the case taking comprises of the observation of the doctor. The observation of the doctor is very important. And 7% of the rest of the communication between doctor and the physician uh, rests on what the patient narrated to the doctor. 93% is the observation. And what that 93% includes, that is what the doctor has observed as from my previous example, gesture. Gesture will not be explained by the patient. Gesture will be taken by the doctor, the attending physician, because he's saying that a patient, if is making any kinds of gestures or making faces or making his wrinkling and his hands like that. So these are all the gestures.
Yes.
And the second thing, patient, if the patient contacts with the doctor by phone call, as for example, one of my patients calls me, is a friend of mine in past. I'm talking about the real case, what I have solved. Patient called me, doctor, are you available on the clinic? Yes, I said I am available in the clinic. Okay, what's the problem? Doctor, I'm coming to visit you. I have a problem. Okay, I've said this thing, and I thought that is far, little bit far. They will come maybe 2, 3 hours after. But I was amazed that what the patient, what it happens after 5 minutes, approximately half an hour, the patient is in my clinic. Okay, he's a friend of mine. Okay, he comes and suddenly, immediately sat on the seat and says, I have this problem and like that. But now, before we conclude and listen to the patient, what he says, one, I thought, when I listened all the complete case, then I applied one rubric, which was the initial one, which I have observed. What that observation is, quick to act, or we can say quick act to. This rubric is in the repertory, quick to act. When there is a disease, so patients has different kind of feelings, and those feelings compel them to uh, make all such ways. Uh, and I applied that rubric in that case, and it was very helpful in concluding that case. This is one tip, that what we have picked from the initial contact of the patient and from the phone call. Yes, if the patient comes in the evening or with a delayed time, it could not be applied. So this
Yes.
is what the physician has to see how and when the appropriate rubric, appropriate explanation of the gesture, and appropriate interpretation of the talk of the patient, and converting it into a right rubric, then you will find a right remedy. And that right remedy is basically the actual management of that patient, because I have seen immaculate results of homeopathy in all such things. When I deliver even a single drop on the tongue of the patient, and within no time, within 1 minute, patient says they have been relieved. This is the marvelous, these are all the marvelous, but this is another separate topic about homeopathy is such a vast field in which we can talk, we can pick every topic for the explanation to all the fraternity, and we can explain and talk a lot of about that. So, in the management of the patient by using homeopathy, uh, we have to see and we have to compete with the time also. What people want in this world right now, people want to be quick and to be their problems to be solved in a quicker manner, in an easiest manner. How we can manage them easily? Now we can I can share with today's one of my today's patients, and I would like to share my screen with you people if I can. Let me see, I can share it with you. If you people can see, I've shared the screen,
Okay.
and that this is the case of arsenic album. I've taken it today. And how today, and how I have had managed that case through homeopathy in less than 5 minutes is in less than 5 minutes is this is a case of a child aged 4 years. The patient is in UK, and I'm in Islamabad. Patient is my one of my relatives, and her mother contacted me via telephone. He called me. He called me in the morning, and she says that her child is having a fever. How much fever? 100.5. 100.5 is the fever. Okay, and then I asked her how it happened. She says that yesterday he was just playing with the water, and in UK yesterday there was chilling cold breeze also outside, and he was playing with the water. Maybe he got cold out of that, but he's not. She's not sure about that. So then, because they are my relative, I asked her if I can talk to the if I can talk to the child. As usually they are relatives, they really phone me, and off and on I've been able to manage uh, talk with them in general when they are not sick. So when I asked her, so the boy knows that I'm a doctor. So at first instance, he says to me, I got a fever and I was sick from yesterday. Then I asked him, "What do you feel?" He says, "I was dull when I got fever." These are actually the words the patient was using. Then I confirmed it because the patient is a child, 4 years child. Then I confirmed all that from her mother also. Her mother told me one more important thing that was important for me, not for them. What was that? I picked this. He says uh, he was not ready to use medicine. I said to her, why how do you know that he was not ready to use medicine? She says, uh, when he got a fever and I was supposed to call you, and he knows I'm going to call you for that, then he says, "Mama, I don't want to take medicine." So that point was very much important for me. I take the rubric, mind refuses general medicine to take the, uh, the important point is mind refuses general medicine to take the second rubric taken was delusion sick me. Third rubric was taken from the further talk of the patient. As I said to her mother, what he was doing is he says when temperature was a bit slight get low, he started his activity and doing all such things and everything. Then I take the rubric mind activity desires activity, and dullness, mental. Another rubric was mind dullness, mental fever during. That rubric was due to when he has more fever, 101, 100 Fahrenheit, 100.5. And then I asked again to the child, what do you feel? He says, well, I'm fine. Although he is having a fever of 100.5 or 100.01 Fahrenheit, and yet he is saying, I'm fine. The rubric was, well, general says he is when sick, when very sick. So I have taken collectively of 5 rubrics. I've shared my screen with all you people if you are still seeing. This is the case I've taken today, and the purpose of sharing it with you people is that it was a talk on telephone call with the patient. The interaction was on phone, and it was very far away. I'm in Islamabad, the patient is in UK. Talk time is less than 5 minutes. This was the data I have taken from the patient. I've interpreted it into the form of a rubric, and that rubric gives me the answer of arsenic album. This is how I have been able to manage the patient quickly, less than 5 minutes. Luckily, they have the medicine there with them, and they have administered that. After 2 hours, they give me a call again for the follow-up. I thought they may be uh, saying that what should we do for the next dose and what like that. But what her mother says to me, she says, Dr. Usman, the fever of my child has, I've just checked it, is 98.5 Fahrenheit. And he is absolutely feeling fine. What they have not told me was at that time that the child was not eating anything. But at the follow-up, time of follow-up, the mother of that child says, now doctor, my child is taking his normal diet. Although I had not asked you about that at that time, but he has had not eaten anything since last night. Now, after administering of the dose, my child has had been feeling hungry and he had taken regular diet. And this is the management of the patient, management of the disease through homeopathy, by homeopathy. In less than 5 minutes of the doctor and patient interaction, the result comes out within 2 hours. So this is due to homeopathy, and we have to understand what we have to understand is we have to take the mastery of all such things, how we can take a case. The appropriate case taking will lead us to the proper cure. This is uh, this is very much important, and I would like to talk about another case because uh, delivering something uh, by giving the actual examples to the listeners and you people can very easily pick up the things what I want to say in this limited time. We have a medicine which we call cuprum metallicum. That cuprum metallicum has a very nice rubric in that. Uh, that rubric was that cuprum rubric. Would like to share with you people is also. Dependency. It's about dependency, and let me see you for it's fear of dependent of fear dependent on being others. Patient is in fear of sometimes I've been investigating different patients, and during the talk uh, they have had the fear that usually it can be at any stage, but usually you can have that fear in the mind of those patients who have been thinking like that, that if something happens with this disease to them, then who will take care of them? This is what the major fear is of dependency. Then who will take care of their children or who will take care of them if something happens to them? Fear disease of impending. So, so this is very much important when the actual rubric. Now I had found it a bit. The fear disease of impending dependent on others to be the only single remedy. It contains only single remedy, cuprum metallicum. And this rubric has helped me for solving a lot of cases when we have been taking this all that. Now come to the topic again. This is all about the management of patients using homeopathy. So we have been talking about the case taking. The very core of the subject is case taking. The better the case taking, the more solid will be the cure and the results. And that case taking includes 93% of the observations of the patient and 7% of the communication by the patient. Let's see. We have had many different steps for the case taking also. The case taking of the newborn is a separate one. Case taking of the child is a separate one. Case taking of an adult is a separate one. These are all the stages, and we can have had separate discussions about how we can take a case of every different kind of patient. Case taking of a paralytic patient or anything like that. One of the, I would like to share one more experience of my case. Child comes to the clinic with the parents, and what he, he was doing is, as he was a child, her parents were narrating the problem that he has been facing this and this and this and this. While I was observing the child, what he was doing, he was doing taking something from my desk, then going on a other side of my desk and picking something from there. Then their parents ask us, don't do that, don't do that. Comes to another side, pick one more thing. That is the main major point. That was the observational point of mine. I the rubric for that child is touching, impelled to touch everything. This is a very beautiful rubric available in the repertory. Touching, impelled to touch everything. This has not been asked to me by the parents during the conversation. What they've been defining me, our child has been facing having flu since 4 days, and this and this, and he's been coughing, and he has a fever. They have been narrating all such things. But what I have had picked out of it, touching, impelled to touch everything. This is the rubric which I have not been able to leave. I have to take it, must, because this is the observational. 93% of that part of the conversation. So how we can leave 93% for anything else? So we have to take it. Then their other talk, they've been asking, child is very irritable. I said, when you feel that irritability, all the time, or you've been facing it when your child is sick. Then they confirmed it. Then when our child gets sick, at that time he was irritable, not on any other time. So I had taken the second rubric for that case, irritability, children in sick when. This is a very important point, and it contains only two medicines. That rubric has only two medicines, pulsatilla and lycopodium. Here, when including the case with other rubrics, but conclusion was drawn with these two rubrics only. Touching, impelled to touch everything, and irritability children sick when. The medicine comes in front is lycopodium. And by administering the dose of lycopodium to the patient, on the very next day, the follow-up, the feedback comes is that everything goes fine. The flu comes down, the coughing comes down, the fever vanishes. In 24 hours, we have been able to deliver the cure or manage the patient, which is child, through homeopathy in less time with the perfect case taking and the appropriate conversion of the talk of the patient in the language of the repertory. This is I have seen this all these capabilities in Segal's mind method, and this I before that, when I have not been practicing Segal's mind method, we usually have to take a lot of symptoms and then concomitants, modalities, and this and this and this. It takes a lot of time for the physician uh, to to reach the right simile. But with the help of this mind method and these observational rubrics, I've been able to solve many cases in less than uh, 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 few minutes, within few minutes. Within few minutes, a physician can reach to the right minimum, and afterwards, the follow-up which comes, and that makes physician happy. This is the management we can deliver with homeopathy to the patients and to those patients which are not able to speak to us directly. And what can you take from the child? He may not speak to you. He may, oh, okay. Homeopathy is such a beautiful field. If the child does not speak to the physician, uh, then there is a rubric. And if he speaks, then there is a rubric. If he not speaks and been shy, looking towards the doctor, I've been doing it like that. I've seen such patients. The child come to the clinic and he's been doing it like this. He's been doing it like this. When I talk to the child, he keeps doing like this. This is what is evading look. The child is evading the look of the other persons. It contains approximately, I think, few medicines, six, seven medicines, I thought so. And what Natromure was the medicine I've in my memory that I given to that child that who is evading the looks of the doctor. So this is the beauty of homeopathy, that we have been able to manage such all such patients with with very accuracy and with an 100% outcomes and results. And this beauty of homeopathy gives more confidence, more encouragement to the doctor that homeopathy is the only one which can deliver. On the other side, we have had, as I've been practicing with Dr. Javed, is my mentor also, and I've been practicing in the hospital also. So we have had also very less time in over there, as there are usually so many people waiting for the checkup. So uh, that minimum time we have to deliver their accurate remedy to them by listening them, by observing them, and this is what management is. As I've given you the real examples of all the cases, as how we can apply quick to act, how we can apply evading look, how we can apply touching, impelled to touch, everything. And this is what was only I've seen in homeopathy. No other science I've had so far seen that we've been covering all such things. And one more case of Nathaniel just come in, it comes into my mind. That case is of a student of uh, 10th grade. So what was that case is he's been irritable, been anger, and all such. These are all the things I've observed in the patient. But the core was that admonition, aggravation. What was that? during the talk with the patient, I got to know this thing as other ones don't know about that. Even the parents don't know about what was all that happened to the child. Is they been suffering for Alzheimer's diseases. But during the talk with the patient, I got to know that the teacher has in the class has uh, insults him and has given like rebooks of anything like that. So those insults and embarrassment. When I asked the student, what happened to you when your teacher has insulted you and he says that I feel embarrassed, I've done nothing, and she has had just given me a report for just for nothing. It was not my fault. So the rubrics taken in that case were admonition, aggravation, elements from embarrassment. So describing, I cannot describe the whole case right now, but uh, making some points over here is that this is what the task of the doctor to uncover, unearth the feelings, the true feelings of the patient, why this all happens to the patient, how it starts, how it starts. We have to uh, take focus on that. That what was the start point of that, and why patient comes to the doctor? What is the concern of the patient? Why is over here? So the concern and the adaptation from where the thing started, one has to look for, and then the reactions. What are the reactions? These are the gestures you can one doctor can focus on, and also this concerns, adaptations, and reactions. These are all the very important parts of the case taking for reaching the simile. And that case taking, right case taking, is the thing by which we can be able to manage the patients from the diseased condition, diseased conditions to the cure level, to the ease level. Uh, now, now I would like to uh, explain further, like with the cases. But I think I've been running short of time that I may not be able to start a new case to discuss and be able to complete that. So uh, I've been
Today we will go to question and answer session, and we can come back to another session to explain or present the further cases, doctor.
okay.